everyone. Today I'm interviewing my first podcast guest. He's a friend of mine, Mario DeSantis. He has been an orchestra teacher at Collingswood Middle School and High School for the past 10 years, and he's been my son's orchestra teacher for the past 4 years. We've been talking a lot on the podcast about breast cancer awareness, prevention, early detection, and I'm going to let him introduce himself, and then we will kind of explain how my message and his message, what he's working towards, work together.
Yeah, thank you, Valarie. My name is Mario DeSantis, and I am running for Congress. I'm challenging Donald Norcross because I believe that we need a healthcare system that's not going to leave us in debt, a healthcare system that's not going to turn you away based on how much money you have, and one that's not going to let patients die. I had no political aspirations. I went to school for education. But me seeing a problem that exists and someone not using their voice to challenge the system, I don't feel I deserve the luxury not to act. So hearing Val's story, I was able to, think about it from the insurance side, the insurance perspective and the system perspective. And hearing her story reminds me of a lot of the topics that we're going to be talking about today.
So as I mentioned earlier, a lot of the podcast episodes and newspaper articles that I've been really focusing on for the month of October, since it's Breast Cancer Awareness Month, we've been focusing on not only the awareness, but the prevention and early detection of breast cancer, which involves genetic testing and mammograms. Unfortunately, a lot of people don't have insurance, and many people cannot afford to pay for these screenings out of pocket. And like I said, we're talking about mammograms, genetic testing, and sometimes MRIs. So what do you want to see happen? What changes do you want to see happen, and how that can help people with, specifically cancer screenings? If they don't have insurance and they don't have money to pay out of pocket, what are they supposed to do?
Yeah. So here's the problem. We do have the people that don't have insurance, like you said, but it's not just that. It's also the people who have insurance who have high deductible plans. Now, every single plan on the Affordable Care Act is a high deductible plan, and they're designed in a way to make you consider if this procedure is $2,500, but my deductible is $2,000. Do I really need to take advantage of this? Is this something I need to do? And then you know what happens? At the end of the year, your deductible resets. And then you have to go through this cycle all over again. Now, what I'd like to see is a single payer healthcare system, which cuts out all of the middlemen. It cuts out all of the attorneys, all the actuaries, all of the businessmen, all the insurance companies, and we fund it from one system. And that works. And I know it works because that's the model of Medicare. And we're going to be talking about the leverage that Medicare has in just a bit. But when you put all patients into one fund, then providers have no choice but to accept the rates that you negotiate with them. So here are some examples. If you went to Cooper University Hospital and you had the Amerigroup health insurance plan, you would be paying $1,390 for a thyroid cancer scan. But if you had the AmeriVantage plan, you would be paying $526. All right, so that's almost $1,000 savings, and that's for the same exact procedure that's in the same exact hospital. Now let's talk about some procedures for breast cancer. For a bilateral mammography, if you're on the United Healthcare plan, you're paying $1,810. If you're on the Oxford plan, you're paying $1,609. If you are on the Medicare plan through United Healthcare, it's $111. You're going to be saving $1,700 if you're on Medicare. And that's because this one single fund has all Americans age 65 and up. Providers do not have the leverage to say, I'm not going to accept those rates, because if they did that, they would be losing out on millions of patients. We can adopt that model together. We can all negotiate those prices.
I wanted to read something that I read on your Facebook. It was, really hit close to home because of what I'm talking about with breast cancer, being a breast cancer survivor myself. But it says, diagnosis of the 4 most common types of cancer in the United States spike at age 65. This isn't because 65 is a dangerous age. Rather, uninsured and underinsured patients become eligible for Medicare at age 65 and can finally seek the treatment they need. We're going to prevent a healthcare system that forces patients to wait until they're 65 to get the care they need because it's the moral thing to do. And it just really made me think of something that I'm focusing on, that, women are supposed to wait until they're 40 to get mammograms, when I know women in their 20s and 30s that have breast cancer, that are dying in their 20s or 30s from breast cancer because they can't get a mammogram until they're 40. So do you just want to elaborate on that? Because I think it's really important.
Do you want to know who's telling you that you have to wait until you're 40?
Yes.
It's not the doctors, it's the insurance companies. Do you want to know who's telling you that you can only have half of a replacement every 2 years of your denture? Or what kind of materials that your dentist can use? It's not your doctor. It's your insurance provider. Mm-hmm. And that's because they're concerned about preserving their profits. And you're right, it's not the moral, ethical thing to do. It's not just that. It's going to be cheaper if we treat these problems sooner, if we treat these problems earlier, before they have the opportunity to get worse. I think it was that early diagnosed cancer patients, the treatment costs are 2 to 4 times less expensive than those diagnosed with advanced stage cancer. So it's not just the moral thing to do. It's far cheaper. We're not going to let the insurance companies sabotage our health.
I've always thought that, specifically about mammograms, that it just seemed that it would be cheaper to let women have their mammograms earlier, rather than, covering the cost of chemotherapy, radiation, mastectomies, removing ovaries, all these things that I just recently went through in the past few months, which I can't even imagine how much all of that would cost, rather than just starting mammograms at an earlier age.
Right. And it's not just your health. It's bleeding into your family's lives as well. Yes. It's bleeding into your productivity at work.
Yeah, it affects everything. Even with my husband, who passed away 2 years ago from esophageal cancer, we were never told that acid reflux could lead to esophageal cancer. They never offered to do an endoscopy or any type of screening. And then by the time he was diagnosed, it was stage 4. And like I said, then they're covering the cost of, numerous different chemotherapies, immunotherapy, all these different things, where he could have just had a scope done years ago and could have, prevented it or caught it very early.
Yeah. And let's talk about treatment too. If you were prescribed prescription drugs for any of these ailments, the cost for these drugs in other countries is far less. In fact, there's something called medical tourism. You think of America as this wealthy country, and we are, but the wealth is being preserved for a few. The wealth is being protected for insurance companies and people who own the system. So let's talk about after 9/11. We say, let's support our troops, let's applaud the veterans. But what happened to the first responders? They had to take a caravan to Mexico to get the albuterol that they were prescribed, which was costing them thousands of dollars a month. This one first responder, she was crying because she was able to go to Mexico and fill a suitcase of this prescription for 5 cents each.
Wow. I just wanted to put things in perspective for everyone listening to this episode. So if you could share with everyone the story that you told me earlier. I think that would help people realize how serious this is and exactly what we're dealing with.
Yeah, absolutely. This is a story I carry with me when I talk to people. This is a story I carry with me when I advocate for these issues. I saw a PBS documentary a few years ago, and it was a story of a mother and her family. Her son was 25 years old, and he was moving out for the first time. He got his first job, but he was diagnosed with diabetes, and the mom was worried because she didn't know if he would be able to change his lifestyle, if he would be able to change his diet. But he impressed her because he was able to do that. He committed to what his doctors told him he had to do, and he was doing really well. His name is Alex Smith. So he turned 26 and he aged out of his mom's health insurance plan, and the premium price that he was quoted for his own insurance was way too expensive for him to be able to afford. He's 26 years old. He doesn't have himself established. I mean, even as adults, we're having a problem affording healthcare. How's a 26-year-old going to? So he thought that he could save the money that he would have put towards his healthcare premiums and just save it for the insulin that he needed. So he went to the pharmacy, and the pharmacist rang him up, and it was $1,200, $1,200 for his insulin.
Wow.
So he wasn't able to afford that. And 5 days later, his mom, Nicole, she found him dead. He was rationing his insulin. He was trying to preserve whatever he could until he got paid so that he could afford his medicine. And this is just one of the many stories that I've heard. I'm sure we all have our own stories that, touch on these topics. And it should not be like this because it is not like this in other countries. We think that we are the best. And you know what? We have the potential to be the best. But we're the best when we take care of each other. And if there's ever been an opportunity to do that, it's going to be now when we're trying to recover from the pandemic. And, that goes back to why I'm challenging Donald Norcross. He is someone he refuses to co-sponsor legislation that's in the House right now, that's in Congress, that could make sure that we pay no more than $200 annually for prescriptions, that make sure that you are covered with insurance from the time that you're born through the time that you die, that make sure that the quality of healthcare that you get does not depend on how much money you have. If there's ever been a more urgent need, it is now.
I just wanted to add, I'm pretty confident in saying that I think all of us know at least one person that doesn't have health insurance, can't afford health insurance, or has health insurance, but they're struggling to keep up with copays. I have tons of friends that don't have any health insurance at all, or they do, and they can't afford to keep up with it. Actually, a close friend of mine has to make monthly payments for dental work that she had years ago. And she's just, it's almost like paying off a credit card because it's just thousands and thousands of dollars. And she's young. She doesn't have this money to just pay all up front. So she's paying that off monthly. I was actually going to say, I just remembered this. When I was pregnant with Jaden, I was 25 years old, and I was a massage therapist for a chiropractor downtown. I worked full time. And I remember my entire paycheck would just go to pay for my health insurance. I did not have money for anything else. Literally every penny went to my health insurance, and I could barely keep up with that. And, it just doesn't seem right. And there definitely needs to be a change. It's very scary to me, especially because I just finished breast cancer treatment and my husband passed away from cancer, that it scares me when a friend of mine will say that they don't have health insurance. I don't, that needs to change.
Struggle.
Yeah.
I'm really happy you brought up dentistry for two reasons. The first one is my partner is a dental clinician at the University of Pennsylvania. And the way that he treats his patients is determined by the healthcare plan that they have. He cannot use a certain material if they're on this plan. He cannot give them this kind of restoration if they have this plan. And another thing is, dentistry is not cosmetic. This is not a luxury. This is care that everyone else has in every other developed country. And it's not just what they look like. If you have any kind of perio disease, if you have any kind of inflammation in your gums, that literally affects your heart health. That literally affects your ability to absorb and produce insulin. So any any work that's not done with dentistry can have further health implications.
So I just want to make sure everybody understands what you're saying. Are you saying that the quality of the materials they're using for dental work and the procedures differ depending on the healthcare plan, meaning that some people won't have quality materials or procedures because of their healthcare?
That's absolutely correct. The quality of healthcare that you get in America depends on how wealthy you are. It depends on how poor you are.
I always read at least one quote during every podcast episode, and I wanted to read this quote. It says, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Martin Luther King Jr. And I just want to make sure that everybody listening is getting this straight. So you're telling me that the quality of materials that are used, the procedures that are done, it's all based on how much money a person has.
Exactly. That quote is perfect because these people cannot control how much money they have. But we have a responsibility to look out for them. And you know what? We're not just talking about poor people. We're talking about people that are under a burden of stress for how much our healthcare system costs. And it does not have to be this way. You're already paying for taxes with the Medicare program. You're paying for taxes for the Medicaid program. And you're paying for your own insurance premiums. If we were to...
Sorry. No, go ahead.
Uh,
I just wanted to touch on something you said because I think it's important to just address this. You know, we're not just talking about one person or one group of people. This is affecting a lot of people, and by affecting so many people, it's affecting society as a whole. So what do you think about that? You know, the people that are uninsured, underinsured, how is that affecting everybody else, just society?
All right, so you're going to be shocked because this bleeds into sectors that you would not believe. It bleeds into sectors of our economy that you would think are completely unrelated. So if you're trying to negotiate a higher salary with your boss and your boss has to pay higher insurance premiums that year, your boss is going to be left with the decision to either give you a raise or pay for higher insurance premiums. It's affecting your children's school district because as they have to pay for higher insurance premiums, a lot of that money is going towards healthcare and not towards education. And you know what? You're funding that by your local property taxes. And the same thing is happening in the municipal insurance premiums. It does not have to be this way. You don't have to worry about losing healthcare if you lose your job. So a single payer system is cheaper, and this has been supported by every single major study. It saves $450 billion per year. And that's because we cut out all of the middlemen and we put Donald Norcross's brother on unemployment. No more insurance brokerage. You have no place in healthcare because you should not make a profit off of people. We can do better. This is not just my story. This is not just Valerie's story. These are your stories. These are the potential stories of your children. Okay, we're going to prevent a system where your children potentially cannot get the care that they need. We're going to prevent the potential for your children to end up like Alec. So if there's ever been a more appropriate time as we're trying to recover from a pandemic, it has to be now.
I'm going to read another quote. Health cannot be a question of income. It is a fundamental, human right, Nelson Mandela. And I just wanted to go back to, because this has affected my life in more than one way, but I just went through breast cancer treatment, and I'm really pushing, women to get their mammograms. Sometimes that would lead to needing an MRI. I'm also pushing genetic testing. And what's interesting about what you're talking about is that not everybody has access to that or can afford that, and that's a huge problem.
Yeah, exactly. So, despite the important work you're doing right now, what we're up against is the fact that if somebody really wanted to take their health seriously, if somebody really wanted to go get checked out, make sure they're healthy for their family, for their spouse, then they cannot do it because of their income. And that reminds me of Alex's mom. She is a tremendous advocate for diabetes right now. And she struggles to give people advice who are in the same situation that Alec was in. Now, when she talks to people from other countries, they tell her that if Alec had lived in any other country outside of the United States, he would still be alive. If he had been in any remote African tribe, if he had been in any country in Europe, he would still be alive. Now, I think a big part of this is shame because Alec didn't want to talk about this. He didn't want to share his struggle. So I think if we're all honest, about our experiences, about our fears, then we can really come together and rally against or around a system that's really going to help every single person in this country.
To add to what you just said, I have watched documentaries about healthcare in the United States compared to healthcare in other countries around the world. And I always found it really interesting because in all of these documentaries, they would interview people in countries around the world and they would explain to them how our health system works. And you could just see the confusion on their faces. They just don't understand why our system the way it is. And they would actually say, I don't get it. If something is wrong with us, then we go to the doctor and it's taken care of. If we need it, we get it. And, it's been explained to them how things have to be approved and they're not approved all the time and people can't afford things. And they just look dumbfounded. Like they can't believe that that's how the healthcare is in our country. I have another quote. It is from Helen Keller. And it says the welfare of each is bound up in the welfare of all, which goes back to what I said earlier. This doesn't just affect one person or a group of people. Like you said, we're not just talking about, people living in poverty. This is affecting a lot of people, our own friends and family, tons of people in our communities. So it's not just affecting that person or their family. It's affecting all of society. And like you mentioned, it's actually starts to leak into other aspects of our communities. And I just wanted to say that I admire what you're doing. I hope in the future we can get together and cover other topics that you feel passionate about. Today, we really just focused on the healthcare. And I love the quote that you have on your Facebook. Let me get it. Be ashamed to die until you've done something to uplift humanity. And I really think that that's what you're doing. And I would love for you to let the listeners know how they can contact you with questions, comments, or ways to get involved.
Thank you. Really, thank you so much for this opportunity because it's an opportunity for us to share our stories, and it's our stories that compel us all to act on this issue. And you're right, that quote is something that I live by. I believe that we all have a responsibility to look out for each other. So if you are interested in getting involved in this, and if you believe in these messages, I can use all the help I can get. If you want to donate money, if you want to help knock on doors, if you want to talk to your friends and family, all of that is valuable. My website is desantisforcongress.com, DESANTIS for congress.com. And I hope to hear from you.
If you have any questions, comments, or just want to reach out, you can email me at valariedancingintherain@gmail.com. And my name is spelled VALARIE. dancingintherain@gmail.com. Thank you so much for listening, and thank you for your support. And then they were smiling. Then they looked sad. And Nadia goes, this is weird. She's like, it's happy and sad at the same time. And I go, that's the whole point.
Right.
I was like, it's like a wave, just like life, just like grief, just like anything.
Yeah, and that's what you talked about in the first episode.
Right. So when she said that, she's 8 years old. I'm like,
she got it.
That's exactly right. It is happy and sad.